As we celebrate Nurses Week and Nurses Month, we know that there continues to be challenges in our clinical spaces and our educational spaces to have enough nurses to do the work that's necessary. Just a couple of weeks ago, I was speaking with an associate dean, and she was getting ready to start the summer semester and did not have enough staff. She was 1 week away from starting new classes with new students in the summer semester and had a staffing shortage. Well, because of that shortage, in fact, 203,000 openings for registered nurses each year between now and 2031 is what the National Bureau of Labor Statistics has reported. And this is what we know, that as of about a month ago, in March 2024, there was a release that came out jointly. Hippocratic AI as well as NVIDIA has released the first, what was quoted as to be the first AI nurse. All right, so of course it caused us to be more curious. One of the questions is, who said that 3.3 million nurses is enough by 2031? The $86,000 compared to $9 an hour that this nurse-like agent provides to the community is a very different cost, right? When you think about it, you compare what your business expense, your budget would look like if you're spending $86,000 on a nurse compared to $9 per hour. That's a huge difference. And 3 million nurses being short by 2031 is a huge number. Well, if you have tuned in with us before, you know this is not normally how we start our conversation. And if you're joining us for the first time, then we are glad that you are here. We're taking a little bit of a different approach. First, I want to tell you what you're looking at right now. We are recording this snapshot via Zoom, and we have developed our content in Canva. We love Canva. So that's Canvas with no S. It is a web-based presentation software. It also can create great images for you. And there's a free version. You can upgrade it to a paid version as well. But this is what we know. And I encourage you to take a look at the description. And that's where you're going to see a lot of links to these resources that we are using today. NVIDIA and Hippocratic AI are jointly moving forward on introducing these health agents into the community. Now, they've already reported that it's been tested, the work that has been built into this nurse-like agent, based on an article that is listed in the description, that has been tested now and introduced into more than 40 healthcare facilities, several insurance companies, and more than 5,000 nurses are testing this technology. So it will be interesting to hear about the results. So we have Canva that we've downloaded. First of all, we included the content for our presentation, and then we downloaded as an MF or MP4 video. And then we added it as a virtual background in Zoom. Okay, so what you also see, aside from the fact that this is information from NVIDIA as well as from Hippocratic AI, you also see some data regarding the salary of the nurse compared to this nurse-like AI agent. So $86,000 is the median salary for nurses of 2023. And this nurse-like agent is expensed, or at least it says that there's a cost associated with it, estimated to be $9 an hour. I'm still curious how they came up with this $9 an hour. Still digging through those details, but this is what we want to focus on. Super staffing in healthcare with generative AI. Okay, so that is what the article and the video is really depicting. So let's take some time to share this video with you. I do want you all to spend some time really reflecting on how this works and how this initiative is going to affect us, because we know that AI is here, right? It's not going away. They're going to continue to make improvements. We've often talked about AI as it relates to papers or any content that is presented as students' work. How do we account for that? How are we asking our students to account for that? Well, hopefully by now we all have a policy related to artificial intelligence that we can follow. First of all, that students can follow, but second of all, that we can ensure as faculty that we are consistent in how we're addressing any questions regarding plagiarism or how students are using AI. Okay, so that's one element. How are our students guided? What type of criteria do we develop for them to let them know what is acceptable and what is not acceptable when it comes to AI? And then the second element we want to consider, which is the focus of our snapshot today, is related to curriculum. So how do we teach students? What content are we integrating into our curriculum to ensure students are ready? That's a big goal that we have when we look at our program outcomes. We want to ensure that students are prepared to, first of all, matriculate through our nursing program, and second of all, to graduate on time, third of all, to be successful on the NCLEX, and finally, to go into the healthcare setting prepared. Okay, we know that there's still a role for our orientation and onboarding. However, we want to prepare our nursing students as best as we can to meet the healthcare needs based on the information that we have. Well, this is a healthcare need, and it certainly can influence the curriculum that we have in place, and even the partnerships that we're developing with our healthcare providers to make sure we as faculty are aware of all of these AI improvements and how they're actually using them in the healthcare setting. And if you're here for the first time, make sure you print out your study worksheet. Okay, that study worksheet is going to guide you as we dig deep into our content today. And also, if you have the study workbook, okay, so study workbook, for those of you that have it, I want you to take a look, and it's going to be on page 16. Okay, this is all centered around teaching strategies. How do we incorporate those healthcare trends, the changes in technology that our students will be facing when they arrive in the clinical setting? The more prepared we are with the development of our curriculum to align with the clinical practices, the more successful our students are going to be in the clinical setting, and the safer the care that they deliver will be. Okay, which we're going to talk more about as we dig into our content today. And then the second resource is Billings and Halstead. So if you all have pulled that out, great. Now, there are several sections that I want to bring to your attention as we talk through our content for today. It is aligning with curriculum development. So page 127, and this is still the 6th edition that we're using. But if you have the 7th edition, you will see a link right here in the description to take you to the actual crosswalk between the 6th edition and the 7th edition. Okay, so Elsevier was kind enough to provide that for us. So course design on page 127, and then table 6.3, you see an example of competency learning progression chart that is provided to you. And then table 6.2 on page 126 identifies leveling competencies across the curriculum. An example that's given is communication. Well, one example we would want to look at is technology, right? Technology in healthcare specifically. So as you explore chapter 6 and looking at different curricular development elements that's aligned with the content we're going to discuss today, I want you to think about what changes you are going to consider in your curriculum based on this new discovery, because certainly it is going to change the face of healthcare. In fact, it has already. So let's go ahead and take a look at this YouTube video that was released, because I want you to have some insight as to this amazing technology and how it can directly affect us.
Manager, how are you doing after your app?
Hi, Sarah. I'm Rachel, your AI care manager. How are you doing after your appendectomy?
I'm good. I'm glad to be home with my dog, Dennis.
It's great to hear that you're back home with Dennis. I noticed that Dr. Chang has prescribed you some antibiotics, specifically ciprofloxacin and metronidazole, due to your ruptured appendix. Were you able to get these medications?
I was. I did forget to mention to the doctor that I am allergic to penicillin. Is it still okay to take the medications?
Great question. The antibiotics you've been prescribed, ciprofloxacin and metronidazole, don't contain penicillin. So it's perfectly safe for you to take them. Can you begin taking them today?
Yeah, I certainly can. Do you have any tips for faster recovery?
Given that you have diabetes, keeping your blood sugar levels in check will be beneficial for your wound healing. Your hemoglobin A1C was at a healthy level of 5.5, but your glucometer readings from yesterday were a bit on the high side. So keep taking your metformin and try to steer clear of foods high in carbs. How does that sound to you?
I think I'll be able to avoid the carbs for the week. I need to go right now, but it was great talking to you.
I'm glad we had this talk. I'll pass along your progress to Dr. Chang.
Goodbye.
Goodbye.
I thought this was really interesting. I want to share. You can look at the full press release. It was actually an interview that was conducted with Dr. Munjal Shah. He's the CEO and co-founder of Hippocratic AI. It's a pretty compelling interview. So that's dropped right here in the description. But I want to highlight just a couple of elements that align with what we're going to talk about today. In fact, this is the first session in our series, but we're going to spend quite a bit of time talking about not only AI, but curriculum involvement, and of course, our teaching strategies that we want to be mindful of integrating those to facilitate learner development. So that's competency 1 and competency 2. But I want to read out just a couple of statistics and statements that he mentioned during the interview. He says, we're missing staff today. There are no follow-up calls. When we don't check on that, patients end up in the ER. We should call every patient 2 days after they start on new medications. 3 million nurses in the US. Is that the right number? How do we know that's the right number? With Hippocratic AI, we have the ability to really hone in on what those individual patient care needs are. And then he talked about the Hippocratic Oath. They were very intentional in the naming and the branding of the company because, of course, it's aligned with the Hippocratic Oath of first do no harm. He also mentioned that there were different tiers with the testing process, and the higher level tier indicated the more nurses and the more doctors that were involved in giving feedback. Because that was my question is, first of all, the accuracy of the information. And of course, we know with AI, there are certainly challenges. I highly encourage you all just to try ChatGPT. 3.5 is the free version, but the 4.0 version is the one that's paid. And I just encourage you to take some time to use that. There are many other platforms out there that you can use, but that's the one that I'm most familiar with. And then he said one other thing that I thought was interesting. And he said, how is healthcare responding to the staffing crisis? He says they are so short-staffed and that there are 40 healthcare systems. Now, this was as of March, I believe it was, 2024, because they just celebrated their 1-year anniversary. He mentioned that in the video on March 15th, and they've raised $150 million. Okay, so we know that there's already artificial intelligence in our healthcare system. So I want you to go back and to take a look at how you have already integrated into the curriculum some of these elements that we need to prepare our nursing students for. So first of all, we have to prepare ourselves. And then second of all, we want to make sure that we are properly preparing our nurses. All right, so if you want to pull out your detailed test blueprint, take a look at competency 1. Okay, we're just going to take a look at 2 competencies. So competency 1, 1D says using technologies to support the teaching learning experience. Okay, so I encourage you to use this video. It's available to you. I'm going to actually add 2 of these videos as well as the article because like I said, this is the first session in a number of series where we'll be talking about this very important topic because AI is here, the AI nurse-like agent. And then the second competency I want you to take a look at is competency 2, specifically looking at D. So 2D says facilitate learners' self-reflection, goal setting, and socialization to the role of the nurse. So just think about those 2 subcompetency statements that I've mentioned, again, as 1D and 2D on the blueprint that's on page 7. Now, if you're on the journey for CNE novice or CNE clinical, this is still important information for you to know. I don't expect any questions would be on the NLN exam if you're taking it right now in 2024. However, I would anticipate that some of the curricular elements that we're going to talk about are certainly aligned with some of the work that is already being done on the nursing side to make sure our nurses, once they are in the clinical setting, making sure that they are competent in using the advanced technologies. But it's always great for our students to be aware as well, because we know they'll be in those clinical settings, working alongside those nurses using the advanced technology. And we always want to best prepare our students for the clinical experience to decrease their anxiety so that it doesn't create a barrier to the learning process. That's the challenge with technology. And we know when the computers on wheels first was launched, that was a huge concern that patients and families felt like we were nursing a computer and looking at a screen instead of looking at the patient. Okay, so we just want to be mindful of that. So let's go back and take a look at our content from our presentation that we want to further explore. So let's start out by taking a look at our thought-provoking question. Okay, so here we go. So our snapshot question is related to AI. So according to the NLN Competencies for nurse educators, what aspects should be emphasized in the curriculum to ensure nursing students are prepared to utilize AI tools effectively in their practice? All right, so we have three options. A is alignment with traditional nursing practices with integration of technology only in the skills lab. B is development of critical thinking skills that enable evaluation of artificially generated data and decisions. Or C, integrating complex case studies in pharmacology and pathophysiology to enrich content. All right, so I'll give you a second to take a look at the thought-provoking question. And this is what I want you to think about with every question that you look at. Number one, what is this question asking me? Okay, so you want to read the full stem. Oftentimes on the CNE exam, you will see a statement or an introduction to a scenario, and then it will be the question. Okay, so think about, first of all, what is this question asking me? And then second of all, what is it that I know for sure about content that is included in this question? All right. Now let's take a look at some of the content that you will use to help align you on your journey, either towards CNE or towards recertification. Or maybe you're just showing up because you want to be a better nurse educator, or maybe you were inquisitive about this nurse-like AI agent. We are aligning our content with the innovative evidence-based curriculum component of the Hallmarks of Excellence. If you're not familiar with the Hallmarks of Excellence, there is a link also in the description, lots of links in this snapshot. And this specific hallmark talks about our ability to think critically, like we're talking about today, to best equip our nursing students with the knowledge they need within the courses, within the nursing program. Second, we want to promote cultural sensitivity. We want to be mindful of our biases. We want to engage our students in a way that creates an inclusive learning experience for our students, and that requires us to be aware of biases, to establish civility in our classroom, to be clear with our students about how we treat each other and what respect looks like. We want to enhance identity formation with our nursing students, helping them understand the professional image of nursing. We want to foster interprofessional collaboration. We have to work as a team in order to provide the best patient care possible. And that is going to require us to not only make sure our students are competent in their nursing practices, but also when we're teaching them clinical, even for didactic faculty, that we are knowledgeable about the clinical experiences that our students are having. Right, so it's all about setting our students up for success. The competency statement, which if you want to take a look at your detailed test blueprint, it is on page 8. Okay, so when we look at participation in curriculum development and design, as well as evaluation of those program outcomes, we want there to be a strong alignment. We're responsible for making sure those student learning outcomes, those program outcomes are aligning with each of our courses and the modules, as well as our clinical objectives, our skills lab objectives that we expect our students to be able to meet in each of our courses and ultimately in our nursing program. Page 118 through 131 is where you're going to find some additional context related to curriculum. Again, it's the entire chapter 6. And this specific competency talks about designing curricula that reflect contemporary healthcare trends and prepare graduates to function effectively in the healthcare environment. So we started with competency 1 and 2, and we're closing the loop and wrapping up with alignment with competency 4. So what are those strategies that we're integrating into our courses that will align with AI, with the pseudo agent, I like to call the image, a pseudo agent of a social worker, and that's what the information that's being published is talking about, that this is replacing a case manager or a social worker with the discharge follow-up phone call, and also with discharge planning for patients before they are discharged. So just think about the current impact of this change and then the future impact as well. All right, so to wrap up, a thought-provoking question. If you chose B, you are correct. Development of critical thinking skills that enable evaluation of artificially generated data and decisions. That's just a fancy way of saying we have to validate that what the information that AI is giving us is accurate, right? We want the nursing students to still develop those critical thinking skills, because we know there are certain elements, at least right now, that cannot be replaced when it comes to critical thinking, right? There's an algorithm, there is smart technology that is incorporated in these AI systems. However, there's still thinking that has to happen by a human in order for us to validate. So we're looking at the data, we're validating what the data is telling us before we're making a decision. A good example is when we are taking a look at our cardiac numbers when a patient is being monitored, especially in a critical care setting. Well, we know that sometimes the line placement can be off. There can be changes in the pressures and the different setups that we have for our tubing. And so sometimes the measures that we're getting for the cardiac output or for the arterial pressures, they can be inaccurate, right? So we have to make sure our equipment is properly zeroed and make sure that leveling happens so that the data that we are getting that is being measured by equipment, measured by artificial intelligence, we still have to validate that that information is accurate. Okay, so we still want to ensure that we have a solid curriculum that is going to promote the development of critical thinking skills for our nursing student. Well, we hope that this snapshot has been helpful. We know that it was a deep one this time, and we hope that also you will take advantage of using these resources, talking to your students in the classroom, talking to your colleagues about this nurse-like agent that is here. It is being used in 40 healthcare systems around the country. It may be one of yours. We would love to hear from you if it is being used in your facility. Reach out to us, info@Dr. Sellars Educate, and we look forward to seeing you next time. Have a great one, everybody.